Good evening, ladies and gentlemen. Welcome to this first meeting of the Health Overview and Scrutiny Committee of this new municipal year. The first item on the agenda is election of chair. So please can I have any nominations for chair, please?
Can I nominate Councillor Akhtar, please?
Is that seconded? Are there any other nominations? No? Okay, Councillor Akhtar, if you'd like to take the chair, please.
So agenda item 2 is appointment of vice chair. Before we start the second item on the agenda to appoint a vice chair for the remainder of this municipal year, I would like to advise the committee of a change of membership to what was previously reported to and agreed at annual council. I can confirm that Councillor Tharper is a member of this committee, replacing Councillor Nawaz, which has been approved by the Labour Group leader and whip. Thank you. Returning to the appointment of vice chair for the committee, do I have any nominations for vice chair? Yes, Councillor Abood.
Can I nominate Councillor Lee Coombs, please, as vice?
Okay, thank you. Is that seconded? Thank you, Councillor Tharper. Are there any other nominations? No? Thank you. As there are no other nominations, I declare Councillor Coombs to be vice chair of the committee for this municipal year. Thank you. So, agenda item number 3, questions for members of the public and members of the council tonight. Are there any questions for members of the public? No? Thank you. We'll move on to agenda item number 4, apologies for absence. Are there any apologies for absence?
Councillor Graham Coombs.
Thank you.
We've also received apologies from Councillor McMurdo.
Okay. Thank you. So, move on to agenda item number 5, minutes of the previous meeting. Does the committee approve the minutes of the previous meeting held on the 13th of April 2026 as a correct record and authorise me to sign them? Thank you. Moving on to agenda item number 6, disclosure of local and or disclosable pecuniary interests. As I know, members appreciate it is important that we observe the provisions in the Code of Conduct relating to the disclosure of interests. Can I ask members to disclose these interests and the existence and nature of any local or pecuniary disposable pecuniary interest in tonight's business? Thank you. Move on to agenda item number 7, Health Watch Bedford Borough Observer. The committee is requested to consider whether it wishes to invite a representative of Health Watch Bedford Borough Board to act as an observer plus at its meetings for the forthcoming year. The representative, Jaglahal, Chair of Health Watch Bedford Borough Board, will be able to ask questions and participate in discussions but not vote. Are there any questions? Thank you. Are there any comments? Does the committee wish to invite Jaglahal, Chair of Health Watch Bedford, to attend overview and scrutiny committee meetings as an observer who is able to ask questions, participate in discussions but not vote? You're all happy with that? Yeah? Okay, thank you. Move on to agenda item number 8. Cambridgeshire Community Services NHS Trust Draft Quality Account. Please could I ask Kate Howard, Chief Nurse, Cambridgeshire Community Services NHS Trust, to introduce the Draft Quality Account for 2025-26. Thank you.
Thank you, Chair. So I'm here to present the quality account for 25-26. noting that it will be the last one from Cambridgeshire Community Services, as we have now merged with Norfolk Community Services and have a very long title of East of England Community Health and Care NHS Trust. I will take the report as read, but just to point out a few highlights. The first section of the report gives you an overview of some of our clinical quality, people and digital ambitions for 26 and 27. These are aligned with our new 5-year clinical and care strategy, which we agreed at board on the 1st of April. You can see from these that we've got some focus points, and these are ensuring we've got the right skills and the right people to deliver our ambitions. We're thinking about our waiting lists and how we reduce those. We're thinking about our future neighbourhood plans and how we're going to underpin those with looking at our digital exclusion and how we use our data more effectively to pinpoint and target services into the right areas. In section 3, you will see some of our performance outcomes for the past year. Priority 1, which in our previous strategy was one of safety, you can see that we have met our outcomes, but in the safety arena there is always work to do, and some of those areas have been moved forward into this year's plan. One of the actions under priority 2, which is our quality area, was how we utilise our data more effectively to think about inequality in healthcare. This is still work in progress, but we are hoping that our next steps around how we use our business intelligence models will help us overlay demographic data with some of our poverty data so that we can see patterns and areas of need. We have noted our waiting lists within the report. Recovery in these areas have been planned and are underway, and we have an extensive section on patient participation and feedback. The teams have worked exceptionally hard in the past year to build our capability in co-production and making sure we are hearing the voices of our patients and carers and communities. And finally, the staff survey results for, again, the last year have been included. And although the results are incredibly positive, again, there is always more work to do and things to learn, especially as we've moved into this new organisation. I think probably those are the key things I wanted to mention. Thank you, Chair.
Are there any comments on the report? Oh, sorry, are there any questions on the report? Councillor Coombs.
I have 4, if you'll indulge me, Chair. Thank you. Thanks for coming. Your quality account lists palliative care and district nursing as a service you deliver in our area. Can you give the committee an outline of what end-of-life and community palliative offer actually looks like in Bedford Borough? Specifically, how the new Bedfordshire and Luton palliative care coordination single point of access is working for our residents, what the out-of-hours pharmacy and medication pathway is, and where, if there's any gaps.
I can answer some of those questions. I might need to take a couple away and come back to Chair and Committee, if that's okay. So for CCS, the district nursing service for us is in Luton, and in Bedfordshire, in Bedford, it is run by East London Foundation Trust. However, we've come together to develop a palliative care pathway, which includes the single point of access for residents. And obviously, both sets of residents have access to the hospice, the local hospice. So single point of access really is around making sure there is one phone number, one point where relatives, patients, anybody that's on the palliative care or end-of-life care pathway can call for support, for medication, for management, for a visit, or just for a chat. Because sometimes, obviously, We want to support people when they're feeling highly anxious or indeed have other needs. So it's quite new. We would hope to be reporting on that obviously in the next year's quality account in terms of the things that we've learnt and the things that we can improve on. In terms of gaps, palliative care and end-of-life care is quite a challenging area in terms of making sure we've got the right resources wrapped around the patients and their families. And sometimes, as with everywhere, those resources can be a little bit challenging, a little bit thin on the ground. So what we've tried to do is wrap around the patient using a number of services. So not just district nursing, not just specialist palliative care, but things like rapid response, which is the 2-hour response time. And we also take ambulance calls from category 3 onwards. So if somebody's palliative or end of life and phones the ambulance, phones 999, if we can pick that call up and go and see the patient. Because actually a lot of times people don't need an acute admission, they need some extra support in the community. So we're trying to wrap around our services around the patients that we have within the Bedfordshire patch. But I will come back with further information.
Thank you. So my next question is about Bedford children specifically. Your report shows neurodevelopmental, that's a very long word, neurodevelopmental and paediatric weights are still above national standards on a 2-year recovery plan. How many Bedford Borough children are on those lists today? How many have been waiting over the 52 weeks? And what is the expected position for Bedford specifically at the end of the 1 year of the recovery plan?
Thank you. I would have to go away and check our current position in relation to that, but I will come back to the committee. The plan is a 2-year plan. Across the organisation, our new organisation, we have something around 12,000 children and young people waiting for assessments within that neurodevelopmental service. The plan is to reduce that to the 18-week wait within the 2-year period by bringing in specialists, consultants, nurses, all working in that field alongside speech and language therapy to increase the numbers of appointments that we're giving to children, young people and their families. So that will be the plan. It is monitored by board. It is monitored by assurance committees as well, just to make sure we're on track to deliver. And at this moment in time, we are slightly above target within this particular area. Clearly, that doesn't help the families that are still waiting as of today. So we've got waiting well initiatives, we've got training, we've got education, we've got touch points with parents and so forth. But we absolutely recognise that it's a very challenging position for our children, young people and their families.
Okay, question 3. So, following the merger with Norfolk Community Health and Care on the 1st of April to form the East of England Community, that very long name that you said, covering 7 counties, Bedford Borough is now one small piece in a very large footprint. 2 months in, how is the committee going to keep a clear line of sight of Bedford services? What local reporting, perhaps attendance to this committee, and Bedford level performance data should we expect from the new trust? And when does that first arrive?
Thank you. So each individual directorate has its own assurance committee whereby individual services are discussed. Now that's not just around performance, but that's quality and safety, that's around metrics, but it's also in relation to, as I say, finance, in relation to some of those services. So there is a clear line of sight in relation to the particular counties that we have across the East of England and how we support them to develop and grow. Each particular area has a director. So we have a director of Luton Adult Services and Bedfordshire Rehabilitation Services. We also have a Director of Children's Services within Bedfordshire and Luton and Milton Keynes. So we've got clear visibility from that senior leadership level. Data is triangulated and sent to board and also sent to quality committee, and in some instances finance and infrastructure dependent on the need. So we do have that governance in place, both clinical but also performance governance in place to make sure that we can see and we have visibility in relation to the services that we offer.
Okay. So now that the merger has bedded in, are there any service changes, reconfigurations or model changes affecting Bedford Borough residents that are planned under consideration in the next 12 months as part of the new Trust clinical and care strategy?
So one of the things we're looking at within the clinical and care strategy, which has an impact on Luton adults, is really thinking about our frailty model. So how we support our residents and our communities locally that are into that sort of, I suppose, that meet the guidance or the national diktat for frail. So we're looking at how we improve those services really, but there's no other service changes across Bedfordshire and Luton. This will be a transformation plan with quality improvement at the heart of it to say how can we do it differently, what's the current need, where are the gaps, and how do we meet those needs. But apart from that, at this moment in time, there is no service changes to anything across Bedfordshire and Luton. And we've discussed the neurodevelopmental pathway and obviously the increase of capacity going into those services. So at this moment in time, those are the two things that we are looking at.
Thank you. Are there any other questions? Councillor Roberts.
Thank you, Chair. I note on page 28 of the report that the Health Inclusion Team, Co-Production Team and the Gypsy, Roma and Traveller community have worked to produce some audio-based educational materials and an animated film on immunisation addressing cultural and literacy challenges. And it says these are accessed via the service website. My question really is how accessible is the website itself for those who maybe have a literary challenge? Because while we can produce educational materials, actually accessing and finding those educational materials may be a barrier to actually looking at them in the first place.
Thank you. So our website has Recite fully integrated within it. So the Recite tool is a tool that can convert documentation or leaflets into any language, which includes easy read materials and so forth. Videos that we make with our communities, if they are in agreement with that, we can obviously add sign language and other languages over the top of the videos, for example, dependent on the need of the community at that particular time. So we can adapt and change based on need.
Thank you. Are there any more questions? Can I ask a question? Thank you. Your staff, what kind of multicultural backgrounds are they from, the staff? I'm just thinking about palliative care here at the moment, so thank you.
So in Bedfordshire, our staff do represent our local communities. So we have a range of colleagues from a range of different backgrounds which bring vast experience and, a really healthy, different way of looking at things. One of the things actually that we've been looking at with our co-production team is how our local communities access palliative care and end-of-life care within Luton and Bedfordshire, or Bedford, sorry. And because we noticed a reduction or a lack of individuals coming forward from the communities that we currently serve. So we've been looking at how we engage particular communities across Luton. And we've been talking to specific leaders, we've been talking to local populations, we've been in doctors' surgeries, talking to people saying, what do you know about us? you know, and it's very different, and actually we've got to really think differently around how we make sure our services are accessible to all. Yeah, it's a great question, actually, multifaceted question, so thank you.
Are there any comments on the reports? No? Thank you. Are members therefore happy to note and submit the committee's draft minutes regarding this agenda item to Cambridgeshire Community Services NHS Trust for consideration? All those in favour, please show. Thank you. On behalf of the committee, may I thank the Chief Nurse for her report and her attendance. Thank you very much. Thank you. Okay. Move on to agenda item number 9. To consider any call-ins. The committee is invited to note there have been no call-ins at this time. We will therefore move on to agenda item number 10. Record of decisions of the executive. The committee is invited to note there has not been a meeting of the executive since the beginning of the new municipal year. Therefore, no decisions falling within the remit of the committee have been made. We will therefore move on to agenda item number 11. Summary of relevant individual decisions. The committee is invited to note that no individual executive decisions falling within its remit have been made since its last meeting. All those in favour, please show. Agenda item number 12, notice of forthcoming decisions to be taken by the executive. The committee is invited to note that no items included in the notice of forthcoming decisions to be taken by the executive from the 4-month period from June to September 26 fall within the remit of the committee. All those in favour, please show. Terms of reference, agenda item number 13. The committee has therefore its terms of reference for noting. Are there any questions on this item? No? Thank you. Are there any comments on this item? Are members therefore happy to note the committee's terms of reference? All those in favour, please show. Thank you. Committee Work Programme 2026-27. The committee has before it its work programme for 2026-27, which includes the outcomes for the Overview and Scrutiny Work Programme workshop held on the 20th of May 2026. Therefore, the committee is asked to agree its work programme for 26-27, noting that there will also be additional items added through the year as members request. To agree its agenda for July 2026 as suggested in the briefing note, and to note that officers will work on programming the items from the agreed topics against the meeting dates throughout the year. Are members therefore happy to note the committee's work programme for 2026-27 for officers to update it accordingly? All those in favour, please show. Thank you. Sorry? Yeah? Yeah.
Thank you, Chair. I was just wondering, looking at the work programme, I noticed that we've got the Bedford Hospital site, quality account performance and palliative care, scoping out some palliative care work on our agenda for July. But I do think it's really important if we can try and get the new ICB to come along to the meeting as soon as possible, just to update the committee, because obviously we've formed this new Central East ICB, and as a committee I don't think we have any idea about how those changes affect our local area, either through finance, through services, etc. And given that it started on the 1st of April, so they've now had 2 months, a 2-month crack at it, and the shadow executive will now be a permanent one. I'd appreciate it if we could try and get them in as soon as possible, just to speak to us, to give us some clarity on how it's going to work moving forwards. Thank you, Chair.
Thank you. I'm sure that can be arranged. Is that okay? Thank you. So that concludes agenda item 14. Thank you all for your attendance and contributions, and there being no other items of business, I declare this meeting closed. Thank you and good evening.